Asthma Allergy Center's Dr. Ravi Polasani. Welcome back to the show.
Thank you. Thank you for having me here.
Well, it's a crazy time of year. We were just talking before the show, the up and down. Last week we were, in the 80s. This week in the 40s.
Yes.
What does that do to the body?
Well, fluctuations, temperatures can alter your immune system. Barometric pressure change can cause a congestion, sinus pressure, and your mood alters. Can go to depression and things like that.
Yes. Yeah, psychologically, it's a bummer.
Yes, and also the virus can get active too. People get viral infections often with the cold weather.
We've got a number of people here at JTV, and some in my family with food allergies, and that is a year-round thing. It doesn't matter whether it's hot or cold or winter or spring.
Right.
Food allergies. Are we seeing more people with food allergies? I don't remember, as a kid, anybody being allergic to peanuts, for example.
Right. So the food allergies are getting, more, but more food intolerance is actually more common than food allergy.
Mm-hmm.
So intolerance is kind of a delayed reaction. It can happen up to, usually 6 hours or so, like a lactose intolerance, gluten intolerance. Those are more common than food allergy itself. When I say allergy, it's an immunologic mediated reaction. That means our immune system responds to food protein and makes certain antibodies, and then when you encounter this same food next time, they have a reaction. First time nobody reacts to any food. You have to be exposed first, and then our immune system makes certain proteins against the food protein, the antibodies, and then after 3 to 4 weeks later, then you're exposed to same food, you have an allergic reaction. Such as skin manifestations or GI tract or breathing issues.
Same food, different response.
Yes, same food.
So let's talk about the difference between an allergy and intolerance. So as an example, eggs and mayonnaise, which, mayonnaise is eggs.
Right.
I know people that they can't eat that because they say they're allergic or they say they have an intolerance to it. I don't think they really know. They just know that when they eat it, they don't feel good. What is it with that in particular, eggs, mayonnaise, or egg product? What is it likely? Is it a food that is prone to being to allergies?
Yes, egg allergy is a true allergy where your immune system involves. So the egg white itself or egg yolk, you can antibodies to both, separate antibodies for each one, and then every time you react, you have symptoms. Symptoms involve skin like hives and rash, itching, and even lip swelling, tongue swelling, shortness of breath, wheezing.
So those are typical allergic reactions, like
Right.
the bee sting kind of thing. So if someone has stomach aches or diarrhea after eating a food, that's not an allergic reaction.
No, not necessarily. That's an intolerance.
Okay.
Yeah, intolerance usually more GI symptoms. Only one system involved. Food usually has at least 1 or 2 systems involved.
Can people grow out of a food allergy?
Yeah, they do grow out of food allergies, especially children. Food such as milk, wheat, soy, egg, kids can grow out of this. By age 6, most of the kids grow out of it. Whereas the nuts, seafood, and fish, allergy will continue to adult life.
Yeah, I have a sister-in-law who's got shellfish allergy, which, it's such a specific thing, and it's scallops, it's lobster, it's clams, but it's not whitefish.
Right. So shellfish allergy and fish allergy is different because they don't cross-react. So if you're allergic to one seafood, you can be allergic to other seafood. So every time you eat the seafood, you would have severe systemic reaction or even mild symptoms too. Can be both.
And so for her, in her case, so if there was a seafood pasta and there were 2 scallops in it, she couldn't go anywhere near it. I know other people that say, "Oh, that's okay. I'll just eat around it." Can you have a different level of allergy?
Yes, you can have even fumes from like a cooking seafood or fish. When you inhale, the proteins can be in the air vapors. It can be the air. You can have a severe systemic reaction. So, a person who is severely allergic to seafood, when the other people are eating seafood, they can have symptoms too.
Just
Definitely.
It can
It's
be in the air.
Yeah. They inhale, they have a shortness of breath, wheezing, and even skin manifestations. Yes.
Can an allergy be fatal?
I'm sorry. Allergic.
Can it kill you?
Oh yeah. It can,
Yeah.
yeah. People get severe anaphylactic reaction where they can have a shortness of breath, wheezing, throat, swelling, and drop in blood pressure, and rapid heartbeats. Yes, they can. They can be. It can be fatal. Every year, at least 200 to 300 people get killed with the food allergies in the United States. Yes.
If you get an allergic reaction, what should you do? If you are prone to an allergy and a severe reaction, should you be carrying around an EpiPen?
Yes, we do prescribe EpiPen. If you think the patient has a true allergic reaction to the food, after the skin test or blood test, you can diagnose. And then we do prescribe EpiPen, and the patient has to carry EpiPen all the time, especially when they go out eat. Usually, EpiPen comes in 2-pack. The reason being, there are 2. The reason being 20 to 30% of patients who use the EpiPen first time, and the reaction can progress. So they have a backup.
You need two doses?
Two doses.
Is there
it used to be only 1 before, now they have 2 because, the reaction will continue. So by the time they get to hospital, it can be too late. So that's why they have a backup there.
What food is the most common for allergies?
So up until January of 2023, there are 8 common foods that would cause allergic reactions: milk, soy, egg, wheat, peanut, seafood, fish. And now they added sesame seeds since January as an allergen that can cause severe reactions.
Why? Do we know why certain foods people are more prone to be allergic to? Are there things in those foods?
The proteins,
proteins?
We make antibodies to those proteins in those foods.
Mm-hmm.
Yeah.
How do you test for when someone has something, a response, like an allergic response, but they don't know what it was?
Mm-hmm.
How do you test for determining what their allergy is?
Yeah, normally we do prick skin tests or scratch testing, where you put different food allergens on skin, different spots, and you scratch it and wait for 15 minutes for the protein to get in. And then you have allergy cells under the skin. They would have antibodies to food proteins. And this food allergen, after going under the skin, interacts with the antibody, and then the allergy cells break open, and then you have a reaction, like a mosquito bite of a reaction, like a little hive. And the other way to test is a blood test. It's called RAS test, where you're looking for IgE antibodies floating in the circulation. They can measure the different class 1 to class 6. You can tell the severity, how bad the food allergy they have.
As people can age out of allergies, can people develop allergies later in life?
Yeah, food allergies can develop any time, but not to the food, especially the seafood, fish, and nuts. Yes, it can happen any time. But food allergies is more common in children, especially the milk, wheat, soy, egg. They start early on, but they grow out of those allergies. Seafood, fish, and nut will continue to adult life, but you can develop these allergies any time.
Now, kids, when they're babies, and I've heard this, different ways, that you shouldn't expose your infant child to peanut butter, until they reach a certain age. And I've heard the exact opposite, that, well, if they get peanut butter when they're, just starting to eat foods that won't cause them to develop an allergy. Is there any truth to either one of those things?
So early introduction is better. Up until a few years ago, we thought you cannot introduce peanut, until 2 years of age. That's not true anymore. Early, we recommend now introducing 1 year of age, so that they develop tolerance to it. Delayed introduction, you can develop allergies. So that theory of introducing later on is fading away now.
All right. And the treatment, well, it sounds like it's avoidance.
Yeah, once it's diagnosed, the best thing is avoid and carry an EpiPen. Even trace amounts can cause severe systemic reactions. So especially to nuts and seafood and fish, so we recommend avoiding them.
The packaging.
If the test is inconclusive, we do recommend like food elimination diet, or only mild reactions, we do food elimination diet. Sometimes we do oral challenge, it graded food introduction. So look for symptoms and treat in the office if there's a reaction. So that way you will know definitely whether allergic or not, especially if the test is inconclusive.
Sounds like everyone's different. One size doesn't fit all.
Doesn't fit all, exactly.
Well, we appreciate your time, and if anybody wants to know more about food allergies or allergies in general, or any of the other services that asthma allergy centers can provide you, they just need to give Dr. Polasani a call. Thanks for being here today.
Thank you very much for having me.
Dr. Ravi Polasani from Asthma Allergy Centers. Next here on the